All right, guys, thanks for joining in, and we'll give it a few minutes for everybody. And today, what we want to talk about is a little bit about pre-existing conditions, particularly blood pressure. So, for those who've tuned in before, I've been trying to connect up, particularly COVID and the health of blood vessels, blood pressure. So, as people are joining in, I just wanted to make sure we continue that theme of pre-existing, but as I'm not going to talk about doom and gloom only. It's going to be happy thoughts. It's going to be proactive things that you can do at home. And so as people come in, I'm going to break down what we're going to talk about today. And I'm going to stick within my time limit because I don't want to get timed out. I want lots of questions, I should say. And for those people who want to go live, absolutely go live because it's late at night. I'm about to go to sleep. And the only way I'm going to stay awake is if I get interesting questions. So shoot me texts as I'm doing the presentation, and hopefully we'll incorporate those in if they're relevant. So people are joining us now. I can see that. And so what I wanted to do was give you a breakdown of what we're going to talk about today. So it's really about blood pressure, but the other pre-existing conditions, which is what makes COVID deadly, right? We know that 80% of the people that get infected with COVID may not even know it, or they have mild symptoms. The 20% is where we, really need to focus in on. And today is not about just COVID. It's going to be about pre-existing conditions. So in that 20%, that pre-existing condition is related to blood vessels, and blood pressure is obviously related to blood vessels. So today we want to talk about the importance of pre-existing conditions, particularly blood pressure, touching a little bit on the COVID, and then move into what type of things you should do in your diet and how to supplement it. So, and then some people have additional questions on what else they can do. And I'll start with my basics again, is that there are 5 pillars. The 5 pillars are this: don't damage your sleep, don't put bad food into your body, and put good food into your body. And number 4 is supplement. And number 5, maybe if we have time, we'll touch upon how to boost that immune system. So let's start and get your attention. So of all the people who've had a stroke, what percentage do you think had high blood pressure? It's a multiple choice question. Maybe 40%, maybe 60, maybe 80. So no matter what you thought, keep it in your mind. But I'm going to tell you that of the people who had the stroke, 100% had high blood pressure. Okay. I hope I got people's attention. That doesn't mean that everybody with blood pressure is going to end up with a stroke, but it's important because, blood pressure is one of the major pre-existing problems with this COVID. And we talked about blood vessel health, but I want to talk a little bit more general things that people can stay with me, and maybe from the questioning, I can go deeper and deeper. So let me give you a recent piece of information. So I do watch cable because there's a lot of new stuff that comes out. So I just heard from Houston that the numbers of the 56% of the deaths were in African-American population. I'm going to explain the science, not the race. But the population of African-American in Houston is only 35%. So there's a disproportionate amount of high blood pressure. That's what I'm trying to get at. And that's deadly because the blood vessels are where ACE receptors are, and that's how the virus comes in. So the better your blood vessels are, the less likely it is for the virus to come in. So let me repeat what I said earlier on. Of the people with strokes, 100% of them had high blood pressure. And so let's keep our blood vessels in order. So then you may say, well, pre-existing conditions like diabetes and heart disease and underlying cancer, old age, these are factors, and you'll be correct. But from Italy, the things we found out from Italy are being reflected right now. That in Italy, 25% had diabetes that end up dying. 25% had heart disease. But more than 50% had high blood pressure. And in all comers, up to 75% of the people who died related to COVID were people with high blood pressure. So that's why I want to talk a little bit about blood pressure, but not go too heavy with the COVID story. For people who want to know more about the blood vessels, I had described it before. I'm going to go over it again. So you may say, well, first of all, let me give a disclaimer. I am a real doctor, so everything I say is factual. And if it's not, I'm going to let you know. And particularly if it's my opinion, I'm going to let you know that too. But what I'm about to say is for information. Hopefully that helps you and is there to guide you. But at no point is what I'm saying a diagnosis or treatment. You should go to your doctor and get the appropriate advice and medication. And I will talk about medication today as well, but towards the end. Let's talk about diet. So don't forget sleep, but I will spend, sleep is such an interesting one, very difficult one, but there is science. But as far as diet, I think most important is what not to have. People know the story about salt intake, but there's hidden salt in canned food, hidden salt in prepared food, so you have to be wary of that, okay? And sometimes it may not seem salty. For example, when I go out sometimes, I feel very thirsty. You can be sure there's a lot of salt in that diet. But I wouldn't have been able to tell that it seemed excessively salty, but by my thirst, I knew it had to be salty. So what not to do is the most important thing in your diet. What else can we say? Well, the obvious, really. So eating out can be a little dangerous because you just don't know what people are putting in there. There are places that tell me that there's no MSG in the Chinese food. I come out with a headache because then I know there's MSG in there. So things like that. And then, so if people have more specifics about what they should or shouldn't eat, fire away. And then more importantly, what to eat. That's a really, really, really good question. I'll give you some basics. The basics are when something looks natural and wholesome, like the whole vegetable, like the whole broccoli or the whole cabbage, I don't really mind what you eat because that's huge progress right there. So it's trouble with my kids to try to find out which one likes what. But I've made it a point that no matter what they like, I'm going to start with that. But I'm going to introduce them to something. They may not finish it. They may only have a little bit, but I'm going to keep on introducing that until it becomes a little bit more of a habit because they're kids. They need to be kind of pushed a little bit. And my hope is that after 3 weeks, their taste buds may change. So there's a little bit of advice for people. Even if you don't like something, try to take a little bit at a time, and then over a period of time, your taste buds start to change. And I'll tell you my own experience that when I get into the zone of eating certain ways, I can stay in that zone, no problem at all. But should I go off that zone for 3 or 4 days, then it's so hard to get back on. And that's analogous to exercise as well. Now, the gyms are closed, so it is so hard to have been used to the gym now to try to do it outside. And, I get into a routine. So the main thing is to get into a routine. We were talking about what to eat. So what to eat, if you wanted to be more specific for blood pressure, is anything with minerals in it. So things that grow in the ground are likely to have minerals. So all vegetables, right? Particularly green leafy vegetables, because they're high in minerals, particularly magnesium. So your kale, your spinach, these are high in magnesium. In fact, things like that are also high in potassium. So potassium you can find in avocados, you can find in edamames, and you can find in fruits like watermelon as well. So a lot of green leafy vegetables, they're grown in the ground. And so, of course, grains are also grown in the ground. So good quality grains are the ones that maybe are not as mass produced like millets. They're also gluten-free. You can have buckwheat, again, gluten-free. And of the grains, you can have quinoa. You can have barley. So there are lots of good grains out there. I'm not particularly fond of wheat only because, I don't want to stop people having wheat if they're doing just fine. But a significant number of the population don't do fine. I'm one of them. So again, so I would just say that the grains can be a source of fiber, can be a source of minerals, and they have B complexes. It is good if you keep the hull, right? So when you have rice and it's just white, that's not good. But should you have the brown rice, you have more selenium in it. But even the brown rice is just like 2 grams of fiber. That's not much. And boy, there's a big difference in taste between brown rice and white rice. Huge difference for a little gain in fiber and a little bit of selenium. So don't let me talk you out of not eating brown rice. But really, if you want the rice, you need the whole hull, the shell with all the nutrients. That's where when you have the whole wheat, it's the germ that has all the nutrients that's in the fibrous part. So listen, so food wise, there is so many foods that are natural that could help lower your blood pressure, but they have to be high in minerals. They should be high in potassium. And now we're getting to specifics. Citrulline is specifically high in cantaloupe and watermelon and beets. So citrulline is very effective because it helps release nitric oxide. In fact, the greens have nitrates, and they get converted to nitrites by bacteria in your gut. That's why when you eat good food, you nurture the gut, and the gut returns the favor by being able to break things down for you. So it's a symbiotic relationship. You eat not for calories and taste, you eat to nourish your bacteria, and the bacteria will then do favors for you. And so the nitrates become nitrites, and then the body can release nitric oxide. Nitric oxide is a vasodilator. And for people who've listened in, nitric oxide is one of those antidotes for COVID. Because when the COVID comes in through the ACE receptor onto blood vessels, ACE receptors are in the blood vessels, they're in the lungs, they're in the heart, they're in the gut. They're actually in many organs in the body. That's why you're hearing cases of myocarditis, that's inflammation around the heart muscle. You're hearing a lot of people with blood clots. That's slightly unrelated. But the more you learn about COVID, the more you're finding these other things. So it's still early days. So we were talking about how the ACE receptors are in those areas, and as such, the COVID can get into the lungs. And for people with blood pressure, those blood vessels are impacted even around the blood vessels around the lung. And that's why it's so deadly when it comes to the lung, when it comes to COVID. But these ACE receptors, you're going to be able to mitigate, you're going to help your body produce less of these ACE receptors if you manage your blood vessels well, if you try to naturally reduce your blood pressure by eating these things. So I mentioned citrulline gets converted to nitric oxide. Exercise produces nitric oxide. Green leafy vegetables is another way to get nitric oxide. Those are fundamentally very, very good ways to actually keep your blood vessels healthy and lower your blood pressure. I talked to a group to tell them that even when you have, so you can have high blood pressure and you can have stiff blood vessels, right? Usually we believe in the medical world that if you have blood pressure for many, many years, almost decades, then it becomes stiff. But I was able to show them that you've got people with normal blood pressure, but stiff blood vessels. The problem with the cases of stiff blood vessels is that they will be lower in nitric oxide. And as such, they will be unhealthy, allowing COVID virus to come in more readily. The middle one, so I gave you an example of people with high blood pressure, stiff blood vessels. Give you an example with normal blood pressure, but they still have, but their blood vessels are stiff. You can have people with slightly high blood pressure, but the blood vessels are soft. So let me go to a clinical scenario. So I'll give you cases. So I've got a case where I have a 40-year-old guy. He's a doctor, and his blood pressure is on the high side. That's why he came in. He wants to get a physical because he's worried about the blood pressure. And lo and behold, when I looked at the central arterial pressure and I looked at the softness of the blood vessels, we describe that as augmentation index. So again, for people who are tuning in, I'm still open. I have offices in Ashburn and Bethesda, Maryland, and we are seeing patients, but we're also doing remote. But for testing like this, in our office, you'd have to come in. Right, and we are gowned up, we're masked up, things like that. So you'd be perfectly safe. But in our office, we're able to identify not only the blood pressure on your arm, but we can look at the blood pressure around your heart, and we can look at the blood pressure, the softness of the blood vessels. Because as I said, the softness is indicative of good amounts of nitric oxide. That will not only bode well for soft blood vessels, lower blood pressure, but it will protect you against COVID. Conversely, the other things that I've just said. So this clinical situation is of a 40-year-old man, quite young in my mind, and his blood pressure is high, and his central arterial pressure is high, and the blood vessels are stiff. That's not good. But then I just saw one of my ladies' clients, and I believe she was in her early 40s, like 42. So premenopausal, no obvious risk factors. She's had blood pressure for a while, had difficulty controlling with blood pressure pills. But under my watch, what we found is that as the blood pressure is coming down the arm, it's still slightly on the higher side, but the blood vessels are getting softer. So that's the right way to lower the blood pressure. Just lowering the blood pressure does not guarantee soft blood vessels, because in addition to the things I just said about the foods to eat and then why those foods are rich in magnesium and minerals and potassium, and the food groups, which some of them are fruits, some of them are vegetables, some require bacteria in your gut. And then now we would need to talk about what other things are part of that pathway to promote blood pressure health and to not stimulate high blood pressure. And for people who are following me, they know that vitamin D is part of the renin system. So taking adequate, that means you should get your levels tested. And if they're low, make them adequate. And so again, this is just general advice. I'm not telling you what to do, how much you take, but for someone like me, I always measure and I give adequate amounts and I follow up with testing to know I'm in the right direction. But vitamin D, question. So there's a live question maybe. If somebody's going live, go for it. I can hear you. Can you hear me?
Yes. Can you talk a little bit about CMOS?
Repeat that one more time.
Can you please talk a little bit about CMOS? I'm hearing a lot about CMOS.
CMOS. Okay. Look, unfortunately, I hate to admit it, but I don't know a lot about CMOS. But I'm going to hazard a guess. If it's green and it's high in chlorophyll, and those are supportive of minerals, then I'm all in favor of it. But beyond that, to be honest, I couldn't tell you about that. If you have another question, we'll continue with you. Do you have another question, maybe?
No, that's it.
Okay.
I appreciate it.
All right. Thanks for the call. But let's
likewise.
Let's go ahead and continue the conversation. As I was saying, that if you take vitamin D in adequate amounts, you support the renin that also lowers the blood pressure. If you give vitamin C in adequate amount, you block that ACE receptors that are on the blood vessels on your heart. So that's another way. So there's so many ways to deal with the blood pressure. And those are the simple ways. Now, for people who are a little bit more sort of into this, did you know that inflammation can also lead to high blood pressure? Because blood vessels respond to it, and that's through an intricate network of the white blood cells, neutrophils, that go to address the inflammation. And by doing so, it has an impact of making the blood vessels tighter and the blood pressure rises. So there's another reason for why people have for high blood pressure. And so the ones I mentioned were more obvious. Inflammation is a little less obvious. And did you know that oxidation can also lead to higher blood pressure? And even more obscure is when people have immune dysregulation. That means that when their own antibodies are out and about, so what happens is the body has to respond to it. And again, just like oxidation and inflammation, the blood vessels are the vehicle where your immune cells are traveling to deal with this immunological dysfunction. That leads to high blood pressure. So let me slow down for a minute and explain how the analogy might follow. So during an acute stroke, there's a phenomenon that we have. During an acute stroke, the blood pressure shoots to above 200 over 100. That's high, because people ordinarily will think that's high and is bad. Unfortunately, doctors like us, we used to make mistakes. That was many, many years ago. We don't make that mistake anymore, thinking that blood pressure was bad. So let me repeat it again. During an acute stroke, that's usually people in the hospital, in the ER, the blood pressure is super high. Now, when we lowered the blood pressure in those days, we caused catastrophic consequences to the stroke, because that blood pressure was responding to the stroke. When you have a blockage, and most of the 80% of strokes are blockages, we call it thrombosis, only 20% are from bleeding, we call that hemorrhagic. When there's a narrowing and an obstruction to the blood flow to the brain, the body knows what to do. It's trying to raise that blood pressure to push blood through the blockage. So lowering the blood pressure had catastrophic effects. So we no longer try to lower the blood pressure during an acute stroke. But all I'm trying to say there is that the blood pressure usually responds to something. I think somebody's trying to go live. Let's go for it.
Hi, good morning, doctor.
How are you? I mean, you must be in a different time zone. It's good evening here.
Yeah, I'm so sorry. I need to ask you, is there any connection of blood pressure with migraine?
There is. So any other questions before I continue?
Yeah, I need to know also that how can we avoid migraine without taking any medicines like painkiller or diclofenac, potassium, or sodium?
Very good. So let me answer those questions. So there's a lot there. I'll try to keep it brief. Thanks for the question. So migraine is a vascular headache. A tension headache is where the scalp is tight and it squeezes like a vice. And if left unchecked, it feels like a migraine, like somebody's throbbing, hitting you. So from a tight squeeze to somebody hitting you. And for people with a tendency, that can trigger a migraine. Now, migraine is a vascular headache. What that means is the blood vessels around the brain are changing. We believe that the initial stimulus is an external factor that makes the blood vessels constrict, get narrow. And nothing to do with blood pressure right now. And then the body responds by trying to dilate. And it's that dilation that gives the throbbing migraine headache. So some of the migraine medication is to make it small again, make it normal. So for people who are bored, don't be bored. I'm going to give you something very, very interesting here. So the best way to try to identify what's triggering the migraine is to do like a food sensitivity test to identify triggers that are creating an immune upsurge, like a little bit related to blood pressure, because remember, blood pressure affects blood vessels. Migraine is a vascular headache. It's a headache that's related to the blood vessels around the brain. There is some similarity. And just to shock you is that unfortunately, the people with a history of migraine do actually end up with more vascular problems like stroke. Luckily, it's not super high, but it is there. And there are genetics for migraine called LRCP. And again, that correlates to vascular problems leading to vascular problems like stroke. So migraines and vascular problems and stroke, they can go in hand in hand. Luckily, it's not a very high risk of that. So the best way to try to mitigate, minimize, prevent is to try to find these triggers. You can do blood tests that look for food, coloring, chemicals, additives, preservatives. And if those show immunological reaction, we have a very specialized test that looks at immunoglobulins. And when there's a certain number that's high, that's suspected. We suspect that could be a problem. However, the test that we do is one step more precise because we look at what's called complement. Complement is specific immune pathways that are out to get you. And so they turn on you, for a simpler answer. So when we identify those, part of my regimen to prevent migraines is to identify and clean the environment. I can't promise it's going to get rid of the migraine, but I can promise you one thing. When you clean up these antibodies, your blood vessels are taking a break. Your immune system is taking a break. Only good things happen. I call that priming. I'm setting the environment before I do my next step. So I prime before I reset, then I reprogram cells, then I regenerate and repair. That's my system, okay? So we talked about just preventing migraines there. I know we're spending a little bit too much time on migraine, but it's still indirectly related to blood pressure because, as I said, some of the more tricky cause of blood pressure, that means they're under the radar, are immune dysregulation. This is an example of immune dysregulation. Not only can it cause hidden blood pressure, but it can also be hidden triggers for migraine and much, much more. It could be a local problem like gastrointestinal. It could be a brain-like headache. It could be the tendons, the ligaments. It could be eczema. It could be asthma, because these are immunological reactions. These are like a variation of allergies. That's why we call it sensitivities, allergies. There's not a precise pinpoint because it really covers a lot of area. The next one is there are some supplements out there that can be very, very good for migraines. Magnesium being the obvious one. The butterbur is one that is quite effective at about 500 milligrams or 2 grams. Again, these are not prescription medications. You can go look for them. What about coffee, caffeine? Yeah, but what does coffee and caffeine do to assist in migraine? They narrow that artery. That's what those triptans, sumatriptan, Imitrex, these are prescription medications that we use for migraine people because they narrow the artery. So if you're getting relief with coffee and caffeine, it's because of the narrowing. And that's fine. Sometimes when I have a headache, I'll take caffeine. That might be more of a withdrawal though. Anyway, so keep the questions coming in. So we talked about preventing it. We talked about taking some of the things like butterbur. Can't even say it right. Magnesium. And so my best way to deal with the migraine is to eliminate and then to make the blood vessels healthy. Because what's happening is, if you think about it, there's a trigger that makes the blood vessels contract, then the blood vessels react by dilating, and that's the throbbing headache. So I just want to calm down that blood vessel immunologically. I want to make that blood vessel healthy. So my way of dealing with blood vessels is not that dissimilar to the blood pressure. What I need to do is make that blood vessel soft and not be stiff and overreactive. I can do it with omega-3s. I can do that with vitamin C's, antioxidants. I make sure that things that make the blood thin, similar to what keeps the blood vessel wall smooth, other things that will also mitigate and prevent migraine. That's about as much time I want to spend on the headache. We want to keep on going here, but questions would be good because I can make them very specific to blood pressure. So let's see if there's any more questions here. I need to know how to control migraine without medicine. Okay, let's go to the next one. Let's hear what can help. How about CoQ10? Okay, so CoQ10, it's an antioxidant. CoQ10, you've heard the phrase that it helps with mitochondria. It does, but it's not the end-all or be-all, because mitochondria is a very complex structure. Where the CoQ10 fits in is that it's part of the electron transfer. So basically, in order for the mitochondria to produce energy, you have to give it the ingredients, and CoQ10 is just one of them. There are many, many other ingredients, particularly like things that donate electrons. So I think vitamin B2, vitamin B3, L-carnitine, vitamin C is part of it, and acetylcysteine. So there are many, many components. In fact, it's almost an error to even try to pin it down. If you want mitochondrial health, you have to look at the whole body and try to, put all the things in place, because one of the reasons why mitochondria is such a hot subject is the first line of defense against infections, against inflammation and oxidation. Not only is it the place for you to produce energy, so it's your energy and it's your powerhouse, but if it's powering an inefficient system, a system that's under stress in the brain, under stress in the muscles, under stress everywhere, it itself gets, the power goes down. So when people want to make the mitochondria healthy, you have to look at what's taking away the power, what's taking away the battery, the energy from the mitochondria. And it's a multitude of things, from being exposed to infections and inflammation, oxidation, and then being hammered by poor lifestyle choices, not sleeping enough, and so forth and so forth. So CoQ10 is part of it, but it's not the whole story. But good question, and keep that coming in. And so let me go into just changing subject a little bit, because when you boost the immune system, you are now helping your body reduce inflammation. That was for some people, they understand that inflammation is, inflammation blocks insulin receptors, causing insulin resistance, and that makes the diabetes much harder to control. Inflammation is 70% of heart attacks is because of inflammation. And we can measure that in the blood test, right? HSCRP. Even dementia has inflammation. Almost every organ, before there's damage, it's preceded by inflammation. So people who know about inflammation, that's what inflammation is. It's just that the same inflammation is not going to cause the same problem in everybody. It depends on your genetics. It depends on your environment. It depends on your life choices. That's why it's so important to take a good history from everybody, do a very focused examination, measure certain things, and then try to fit the puzzle to know who needs what. Because two people could have blood pressure, but the advice will be a little bit different. Two people could have diabetes with the same recording, same blood sugar levels, but they need different advice. Because in all of these situations, just controlling the sugar is not enough. Controlling the blood pressure is not enough. You have to look at what's underneath. Because even when you control the sugar and the blood pressure and the cholesterol, you still get heart attacks. You still get heart disease, because there's other things below it. So talking about immune system, if you can boost the immune system any which way through antioxidants and so forth, you are now supporting your body's ability to reduce inflammation. And if you do that, your blood pressure will come down. If you do that, your insulin will be more sensitive. If you do that, your blood vessels will be healthier. The risk of you having a heart attack go down. So all these people that have come to me recently looking to boost their immune system, what they didn't realize is that they're actually preventing a heart attack. And I can guarantee that. Doctor, does high blood pressure affect minorities more than other people? Look, in this setting, it's a complicated issue, but minorities generally are associated with maybe more difficult environments, difficult socioeconomic environments. Minorities are the ones that end up, when the Italians and the Irish came to America, they were minorities. They were given the dirty jobs and so forth, and they didn't have the best nutrition. So, just to give you an idea that minority is not a bad word. It's, no matter what, there's inequities around the world. But for the sake of the medical expression, I would say that my observation is that the minorities and the ethnic group do have reasons for having more comorbid conditions like diabetes, heart disease, blood pressure, so forth. So I would say that they're at higher risk, but it's not because they're poor necessarily. It's not that they just have a hard time, but there seems to be a higher preponderance of that. Like in my own community, I'm hearing a lot of people whose parents are ending up in the ICU because of COVID, because they're old. So you could say that they have more pre-existing conditions as well. So see if anybody wants to go live with me. I know it's late at night, but like I said, you need to keep me awake here. So the last time, I'm going to tell you, when I finished at 10 o'clock, I couldn't sleep at night because I got so energized from this conversation. So tune in on Thursdays. I'll be going live on Thursdays, and I plan to go live probably on a Tuesday and Wednesday around 12:30, 1 o'clock. So at least 2, 3, 4 days in the week, I want to go live. So keep your ears peeled for that. And then let's see here. Maybe somebody else is wanting to go live. No. It's connecting. Okay. Okay. But sometimes we have technical difficulties where people can't get in. So let's go back to the immune system. And so the way I like to approach the immune system is to understand that there's a connection between the gut. I don't try to make shortcuts. Some people ask me for quick answers. I got to try to give them a quick answer. But it starts in the gut. Then the gut and the liver are very much connected, and then the gut and the liver then are integral in that immune system. Immune system doesn't just stand alone. There are specific combinations to support the immune system quickly. There are things to support the liver quickly. There are things to support the gut quickly. But I like to, in the long run, make sure that they're all. Oh, we got somebody live. Go for it, please. How are you? Fire away. Do you have a question? I think we have a connection issue. We'll just give it a second. And if it doesn't resolve, then we'll just keep going. I can hear you. Can you hear me? All right. Sorry, we had technical problems there. I think somebody said coffee, skip the coffee. Okay, let me talk about coffee for a second. About 60% of the population are deficient in an enzyme called cytochrome A12. These are in the liver. So you have lots of cytochromes in the liver. That's why genetics is important. Just because you have a liver doesn't, and everyone has a liver, but last time I looked, but all livers are not equal, because you can have genetics that stop certain things from working out. So one of those is the cytochrome system. There are many cytochrome systems, but the cytochrome A12, which 60% of the population have, means that they can't break down coffee. I'm one of them. Unfortunately for those people, there's more of a link with blood vessel problems like getting blood pressure. So somebody mentioned, should you skip the coffee? It's a good idea to skip the coffee if you have blood pressure, as well as cytochrome A12. I have cytochrome A12, but because I take such a good care of producing my nitric oxide, exercising, being careful not to put the bad things into my diet, eating the good things, supplementing, that I can get away with the coffee. But I do have moderation. In other words, I don't want to overdo it. I enjoy it, so I have my cup of coffee. And what they say is above 2 cups might give you the more detrimental effect. But even that 2 cup is dependent on if you have that enzyme. For people like me, they would say 1 cup or no cups. But, I can get away with 2, maybe even more, because I do a lot of the other things to compensate and protect that blood vessel. But the point is that I haven't got the consequences because I've protected myself. But those who with the A12 deficiency, you can't break down coffee. You'll stay awake at night, and you'll also have higher blood pressure. So for those people, it's advisable not to have the coffee. But should you want to enjoy the coffee, do it in the morning, and then make sure you invest in the blood vessels, exercise. Don't put bad things in. Put the good foods in so you can make the nitric oxide. So there are some more questions. Not sure if anyone asked, there's somebody else going live. So not sure if anyone asked if there is a possibility to being taken off blood pressure. Yeah. So absolutely. The question is, can you get off blood pressure pills? Oh, absolutely. Right. Like with anything, if you're willing to follow the 5 pillars, which is figure out about sleep and optimizing sleep, don't put the bad things in. And we guide you with blood testing what to avoid. Then eat the right food. Then we guide you where the vitamin deficiencies are. Then we supplement, focus on what your needs are. You will lower your blood pressure. I guarantee you'll go down on your medication. And for people with just a little 1 or 2 medication, I inevitably get them off the medication. And oh, we got somebody live, far away.
I'm seeing some Brazil nuts right now, for selenium. But anyhow, I'm a big fan of your work, man. It's amazing work. I love.
Appreciate it.
Yeah, it's great. It's great what you're doing. Spreading the knowledge, what people need. I think everyone needs.
Appreciate that. You have a quick question that we can enlighten our audience with?
Yeah. Let's go. So do you think we could get to a point in society where everyone's immune system is completely optimized, where this virus will not affect anyone? So it will be only the very healthy people going outside and doing their things, and only the people with underlying causes staying home.
You're on the money, my friend. You seem like a young guy, but you're very smart. You're on the money. We're going to go there. And now I can say that because it's out in the public anyway. So thanks for the question. I'm going to answer it. So if you want to stay tuned.
Thank you.
And stay on and ask more questions later on. So this young man said 2 good things. He was eating a Brazil nut, which is high in selenium, and selenium helps produce glutathione. That's your master antioxidant that comes out of your liver. So a plug for him. He's eating his Brazil nuts. And then he mentioned something very, very, very interesting, right? He said that can we all just boost our immune system? So I can say this without offending too many people. Look, we've all been quarantined. We're getting tired. I'm getting tired. You're going to get, what do you call it? What do they call it? When you get closed in? Cabin fever. Sorry, I got to laugh about it. It's getting tiring. But hang in there, right? Because what we're going to do now is a 2-pronged approach. Boost your immune system, which I'm going to continue the conversation. What this young man was saying is this. Because of the people with the pre-existing conditions, they're the ones at the highest risk. It's now time to have them protect themselves, give them masks, have them quarantine, be extra careful so that other people can be free to get about. Because we need to start to get to some normality, not for money's sake, not for business sake, for people's sanity's sake, right? But let's do this in a structured manner. So everything that young man said is exactly right. But we've come so far in getting that peak down, controlling things. Now would be a really bad time to just go back to usual. Now it's about testing, which, if you look at the news, you're gonna know who to believe. Yes, testing is available. No, testing is not available. I'm a physician in the front lines. I have physician friends. You can do testing, but it's all over the place right now. But that's okay. We're not blaming anybody. We got to know who is immune, or hopefully are immune, who is not immune, who's infected, who to quarantine. But what that young man said is that the real people in danger, the ones with the blood pressure, the one with the diabetes and the heart disease and the older age and the cancer, the obvious ones, you want to get them quarantined. Now, unfortunately, that could be 1/3 of the population. And I'm not sure there's 100 million masks to go around. But that's what we got to do. You got to get the masks to everybody, have techniques for sanitation, reuse them wherever possible, and then get more out there. If you don't invest in that, the economy is going to stay shambles for months and months and months, maybe years, who knows? That's number one. Protect the people who need it most by having them have face masks. The other one is, as I said, the more people that get tested, who can freely mix amongst family members, right? So at Next Health, we are doing the things which are acceptable by the FDA and the CDC, which is the PCR test looking for, are you infected or not? We can also do the antibody test, but the CDC haven't given a green light. They're just waiting a little bit more, but we're doing our own in-house, but we're not offering that to beyond our 4 walls right now. But we are doing the acute testing, like, are you infected with the infection? So we're offering that, and that's good to know, so that to self-quarantine and how long to quarantine. But he brought up what we want to talk about. We want to boost the immune system. Don't be passive. When you boost the immune system, you're protecting your blood vessels. You're reducing inflammation. Guaranteed, you are now suppressing that ACE receptor. If that's the case, then boosting the immune system is the perfect way to prevent the virus. Should you get the virus, you can eliminate it faster. What's the difference between somebody that gets better after 5 days versus 3 weeks? I put it to you, it's the quality of the blood vessels. And the quality isn't the blood pressure on the arm. The quality is dependent on the softness of the blood vessels, right? And they become soft when you have antioxidants. They become softer when you have omega-3, vitamin D. They become softer when you have mineral. You need the whole shebang, but you just don't know who needs what without testing it and getting a full history. So I saw a doctor interviewed that said he had treated about 300 COVID patients, and that diabetes and prediabetes were the ones that ended up in the most severe condition. Nobody's arguing that. Why would that be? Because diabetics have blood vessel problems. So there's two problems with diabetics. They have high sugar that causes glycation that has own problems. But the majority of the blood diabetic problem is related to blood vessels. Number one, almost all diabetics, as a general rule, have twice as many heart attacks. Remember the word heart attack and blood vessels, right? So diabetics have blood vessel problems that cause damage to the nerves on the ends of the fingers and the feet, giving glove and stocking neuropathy, numbness, tingling, or worse. And then diabetics have what we call nephropathy, the tiny blood vessels around the kidneys, and they cause kidney damage, and that's the leading cause of people going to renal failure, being on dialysis. However, number two leading cause of going into renal failure and needing dialysis is hypertension, particularly people who don't get diagnosed by not getting tested. And then with diabetics, they also have complications with the eyes because you have very small blood vessels there and they get damaged. So new blood vessels create weak blood vessels that bleed and then stop the vision. And worse still, they pull on the retina and can cause retinal detachment. So that's a kind of a summary of what I'm saying. But interestingly, whether it's Italy or in America, what they're finding is that blood pressure is the bigger risk factor for COVID because the diabetic has a blood vessel problem, the cardiac patient has a blood vessel problem, and clearly the high blood pressure has a blood pressure problem. So that's why it all boils down to blood vessels. But there's no point arguing about the substitutes because you won't know if you're the diabetic that ends up with the problem. You won't know if you're the heart disease that ends up with the problem or the blood pressure. If you have pre-existing conditions, I would take it seriously. Protection, try to get the masks. Now I can say that we're able to get certain higher quality masks, not all the N95s as of yet, but we can get the KN95 masks. And that's better than nothing. It certainly beats a surgical mask, which leaves gaping holes all over the place. Better than nothing, but really not of a good standard. So KN95, it's available. So if you're interested, get in touch with us. And then as soon as N95s become more available, we'll again give it to the people in need, meaning the people with pre-existing conditions. Better than nothing. It certainly beats a surgical mask, which leaves gaping holes all over the place. There's an echo in there. So whilst we're waiting for the echo to disappear, any more questions? Good question. Keep them coming on. Anybody with live? We talked about immune system. Really, as the young man said, hopefully he'll come back on because he seems smart. He'll ask some great questions. You're never too young to boost your immune system. I'll tell you why. When I tested my 16-year-old daughter, her antioxidants were so low. But what can you tell young people? You just sort of work with them. But something must have worked. When I repeated it when she was 18, it was much better. Was it perfect? No. And those antioxidants are reflective of the immune system. So when I measure people's antioxidant levels, the higher your antioxidant level, the stronger your immune system. The people that always came with anxiety and depression, they universally had low antioxidant levels. They universally are the ones that would come down with a sinus infection or a bronchitis. Here I'm going fast again. I'm getting all excited. I'm going to calm down and stimulate my vagus nerve. Take some deep breaths. So look, I'm telling you, nobody's immune. The young, the old, in between. I'd like to think that everybody's healthy, but as we were saying that in this Western hemisphere, nobody's sleeping enough. Nobody has a perfect diet. Nobody's eating all the foods they need to eat. And don't tell me you don't need to supplement. 90% of the people I test need vitamin D. 95% of them need B12. A lot of people, at least 50% are low on omega-3, and the list goes on and on and on. But I test, so I know. Does keeping the diabetes and blood pressure controlled reduce possible complications? Absolutely, absolutely. So don't at any point think I am telling people, don't worry about lowering the blood pressure and the blood sugar. All I'm saying is go below and deal with insulin resistance. Go below and deal with the inflammation, and you'll get even better blood pressure and blood sugar and be much more healthy. The reason I say that, because we have studies to show that people that have had heart disease and heart attack, they then go on to control their blood sugar, the blood pressure and the blood cholesterol, and they only have a 25% reduction in other subsequent heart attacks. That's appalling. The 75% is because they didn't address insulin resistance. They didn't address inflammation. They didn't address dense particles of lipoproteins called lipoprotein little a, and just dense LDL. And for people who saw me interviewing one of the doctors, we were talking about oxidized LDL. So you have LDL, it could be normal, but if it's oxidized, it's highly risky for blockages and for creating the environment for heart attacks. I'm sorry I may have missed it, but about the KN95 mask, are they safe as 95? Listen, KN95, I saw it. They're thinner, they're softer, they're not as good as the N95. And the N95 is adequate for healthcare providers, and there are N95s with respirators, which are even better. So I would just say that the KN95 is very good. It's far superior than any other mask that you're going to get on the market. Short of N95. What would cause one's peptide levels to become high? Interesting. Peptides are messengers around the body. So you have peptides in your intestines, you have peptides that release growth hormone, you have peptides, even your insulin is a kind of a peptide. So peptides are messengers. So I would say that if because I'm not sure exactly which peptide you're talking about, but after the age of 30 and 40, people's growth hormone peptides go down, particularly the growth hormone releasing hormone peptides. And then, there's a prescription product on the market for insulin sensitivity for diabetics, but I think people who are not diabetic, well, actually, I shouldn't say too much on live air. I would just say that people who have diabetes and have insulin resistance, that GLP receptor agonists like Bydureon and Trulicity, these are peptides as well. So so the question is, why does it work on diabetics? Because those diabetics are low on the peptide. Those peptides come from the intestinal lining. Another word for them is called incretins. So they're low in diabetics. By giving them these peptides, they have much better insulin sensitivity. And so, you can take that analogy to so many areas. People after the age of 30 and 40, their testosterone goes down. But don't believe what the hype. Don't believe what people say. That's what happens if you do nothing. But if you talk to people like me, like myself, my testosterone has been steady for the last 20 years. Steady, hasn't even gone down. And my blood pressure hasn't gone up in the last 20 years, even though I have genetics for it. And as far as blood sugar, I have genetics for blood sugar from my mom and my dad. And don't believe my sugars are perfect, but my hemoglobin A1C is going down. So don't believe the hype. There is always a way to optimize health. So as you get older, you can actually get healthier, particularly if you follow the 5 pillars, okay? Now, next question. Does low-calorie, high-fat affect blood pressure? Would it give more inflammation? Okay. So it was low-calorie and high fats. Let's keep it simple. It's not just low-calorie, which is good. It's where those calories come from. It's not high fat. Is it clean fat? So let's get that cleared up. But I'm pretty sure the questioner knows what they're talking about, but I just wanted to make that clear. So caloric restriction has been proven to support longevity. That's where intermittent fasting has taken a lot of footing. And in fact, there's studies to show that intermittent fasting can actually lower inflammation. High fats are going to balance out your omega-3 and omega-6s. So in the environment, we have too much omega-6 from processed food, packaged food, and we don't get enough omega-3 because we don't have enough fishes and we don't have things high in omega-3 like seeds and nuts. So I would say that good healthy fats from vegetable sources primarily, that means avocado, coconut, almonds, olive oil, seeds, nuts, these are all good sources. And then fishes, no doubt. Fishes, whether small fishes like anchovies, sardines, herring, which again, you got to get them frozen because they're not local fishes. And then mackerel, again, they're not local fishes, but you can get them. And then, of course, the tuna and the salmon. I like fishes, you might be able to tell. We'll do some cooking demos with those, and hopefully you'll like those. And so we're talking about the healthy fats. The healthy fats, I think, are from ideally plant sources, and then the fish sources. And then if you have animals that are fed well, like beef that are eating grass, or lamb and goat that eat grass, so the good nutrition will be in their body, and then you eat them, but in moderation. Okay, hopefully that answers. And low calorie, I myself, I'm a 1 meal a day person. And in addition, what happens is that if you try to get rid of refined calories, so the sugars are out for me and refined carbs are kind of almost out for me, then not only am I getting reduced calories, but I'm not getting the refined calories, number one. And I'm trying to lower the calories, but I have to have enough fuel because I try to work out too. So I make sure I have complex carbs that get broken down slowly. Good question. How about this? My diabetes kind of reversed and I get rapid dangerous lows. My peptide level was tested and 2.5 times normal, but no. Okay, that's a pretty complicated question. So just the gist of that was, something about low peptide, my sugars go too low. But, when you start having that discussion here, I would say that's too complicated to have a general conversation here. If you need it, if you want to have a deeper conversation, get in touch with me. If you want a consultation, get in touch with me. We're doing remote consultations and so forth. And let's see if anybody else wants to go live. If not, then we will try to continue the conversation. Let's get this ugly guy out here. Get him out of the picture. That's going to get you. Yeah, it's opposite. All right. Come on. What are we doing with time here? With time, we've only got 10 minutes. We've got to get some quick questions, fast questions. Somebody sent a request for a live. I see there. And thank you for the thanks for the information. You can't go wrong with low carbs. I think particularly when you're after the age of 30. Now, 30 is still classified as a young person because maybe I'm getting old, but 30 is still young. But after 30, you have to be much more conscientious. I keep talking to you about how refined carbs are bad for the brain. If people have the ApoE gene from the 30s, you got to take action. Otherwise, you'll suffer like I did in my late 30s, and I didn't realize it, but I had the ApoE gene. But that was 20 years ago. We didn't have the ApoE gene available to us 20 years ago. So I always tell people, if I knew then what I know now, I'd do things differently. But now you have the wisdom of what I'm telling you. So you know what to do, so do it. All right. So listen, the whole conversation was about pre-existing conditions, but particularly blood vessel. So let's talk about prescriptions right now because we don't have a lot of time. ACE inhibitors are the first standard of care. For some reason, they don't work as well on African-American population. Our second line is calcium channel blockers. Those two I have no problems with. I dislike diuretics. That's supposed to be the first line in hypertension as opposed to in America. Europe may be a little bit different. I believe Europe are a little bit wiser. They use ACE inhibitors and calcium channel blockers. Diuretics are designed to dehydrate you. They're designed to waste sodium, which sounds great, but you are dehydrated. You lose potassium. You lose calcium. I do not like diuretics. The only place for diuretics is when people are fluid overloaded. That's a medical terminology. In other words, people are holding on to too much fluid. They have edema. Believe me, diuretics are the least of your problems. When you have edema, you have lost so much intracellular fluid that it's now spilling out. That means intracellular fluid, for people who've been following me, it should be 60% inside the cells and 40% outside. When you go 50-50, you still don't see edema. When you've lost more than 50% of the fluid inside the cell, when it's supposed to be over 60, and you get more than 50% outside the cells, and God knows if it goes to 60, then you get edema. And then your doctor thinks he's treating you with diuretics. He's controlling your edema, but he's not treating you, because unless you know why the fluid is leaving your cells, that's not called treatment. That's Band-Aid, okay? Just like lowering the blood pressure, and when you stop the blood pressure pill, the blood pressure is still there. Did you treat it? No, you Band-Aided it, okay? There's a time and a place for control, and then you better have plan B to treat it, to fix it. Same with the diabetes, try. I mean, if people leave it too late, nobody can fix it. I get that, right? So the question really here is bring the sugar down, but understand how to, make the insulin last longer, make the insulin more sensitive. So can you help with Lyme disease? Yes, we can definitely help with Lyme disease. So contact us. We'll get into more detail. And then 30 years young. Of course, that's young. I'm 51 years young. And when I'm 61 years young, I'll still be young. And so you're as young as you feel. So the point is that if you produce your nitric oxide, your blood vessels will be young. Actually, the phrase, which is absolutely true, you're as young as your blood vessel. 100% true. This is not just some saying. I'm telling you factually that as you keep your blood vessels young, you are young. If your blood vessels are young, you're not going to get a stroke. You're not going to get a heart disease, much lower risk. So not only is this just a terminology, it's a fact. fact that can be objectively quantified by measuring your nitric oxide level, measuring the softness of your arteries, which is called augmentation index. What about fatigue and concentration issues? What about the causes? Always look at the causes. So what in that situation, you need to take a detailed history, because fatigue and lack of focus, they seem just such simple, trivial things. They're very complicated. In order to get to that, you must get a thorough history, do a very focused exam, and start to utilize that history in figuring out which tests will reveal the information. Fatigue, again, you could say, if you wanted to guess, it's at the mitochondrial level. But the mitochondria is not some easy solution with a quick CoQ10. There is no easy solution to mitochondria. You'll see TV ads for NR, nicotinamide riboside. That's a special form of vitamin 3 that raises the NAD. There is no quick fix. I've taken it 2-3 months myself because, like anything, I try a lot of things on myself. There is no quick fix. And I don't even have chronic fatigue. Maybe that's part of it. But it's very complicated. It needs to be done in a systematic manner. History, physical exam, looking at the lab data, obviously look at the obvious things like thyroid, but it goes much deeper than that. Okay, sleep apnea, BiPAP, changed my life. Just one possibility though. Sleep apnea changed my life. Just one possibility though. Okay, sleep apnea, it needs to be managed, because if you don't, you're going to wake up tired. And people with sleep apnea, the studies that were done, they had low testosterone. So I'm not sure what your testosterone is, but if you treat the sleep apnea, and I say treat conservatively, the best we can right now, and I don't have a better treatment. I just try to get the body healthy and try to figure out if that improves it. And but the BiPAP will help you get good night's sleep. So if you have a good night's sleep, you feel rested. Hopefully that will preserve your testosterone, preserve your cortisol, so you won't get adrenal fatigue. So you have energy, so you can go work out and do all the good things. And for some people, if that helps them lose the weight. But the problem is that a lot of people who are not overweight that have sleep apnea, the problem is that it's more complicated. So it may be much more complicated in terms of toxicity, things we're interfering with receptors. There is central sleep apnea. It's not just the airways and big obesity and just collapse of the airway, but obstructive sleep apnea means airway collapse. Good question, and I'm glad that the BiPAP is working for you. That's great. Is it possible to discuss the use of herbs such as hawthorn berry for managing blood pressure? I know we're running out of time. I can definitely bring it up in the next session. Yeah, I mean, look, you should, because I'll do a little research on it. I'm not that up on hawthorn per se, because as you may gather, I do a lot of metrics. So I have to try to see the things that are measurable. I don't have a way of measuring hawthorn. That's not to say I won't use it. If something works, then I will definitely use it. So I'm definitely open to researching a little bit more. Do educate me. I'm open to learning from people too. But because it's not a metric that I use, a measurement that I have, I can't add to that. But thank you for that comment about hawthorn berry. And what about B complex? Would that have? Definitely, B complex are part of your metabolic pathway. So when we talk about mitochondria working right, B2 supports B3. They're necessary. B vitamins support metabolism at the mitochondrial level. They support metabolism at the liver level. So B vitamins support the methylation pathway. Methylation does so many wonderful things like absorbing nutrients, detoxifying the body, processing neurotransmitters, so your happy pills. So, and as I said, don't forget, the gut and the liver are kind of stuck like this. So anything that is absorbed from the gut has to filter through the liver 100% of the time. That's why the liver is an amazing organ, but as amazing as it is, it needs a lot of help. So when people's liver enzymes are slightly elevated, you need to bring that down. And again, I don't want to talk too much technical stuff on the live. I think if people are interested in learning how to make the liver more functional, finding ways and metrics to say, the liver may be looking a little fatty, the liver may be under a little toxic burden, contact me and I'll go over that with you. I'll guide you at the very least. I didn't know, but I discovered that the testosterone issue before the BiPAP. Listen up. So I don't know what it is. You have to measure it. I've been measuring mine. I measure a lot of people. I measure young people, middle-aged people, old people. But it's the reason why I like to measure testosterone in men, particularly, and in women, by the way. So let me tell you, 1 in 2 women have osteoporosis, and testosterone makes the bone stronger. So it's not cause and effect, but it's an association. 1 in 4 men have osteoporosis. They have low testosterone. The study, as I said, was in sleep study people, because sleep is such an important part of releasing growth hormone and other hormones. And the growth hormone supports the testosterone. and all it's a master hormone, so it supports everything. So it's no doubt that in some way, directly or indirectly, it's going to affect every hormone in the body, not least testosterone. But the reason why I like measuring testosterone is like a stress hormone. So when your body's under stress from exercise, too much exercise, not enough sleep, bad diets, it takes an impact because the body turns to testosterone to repair, and then it gets depleted and depleted.